We're talking about Jennifer Aniston's interview. And when I put the story together today, we're going to use part of what she said in this interview. And she used these words. She said, "I would have given anything if someone had said to me, freeze your eggs, do yourself a favor." Have you heard those words before?
I have. I have heard it before, and to me, in a way, we think of Jennifer Aniston as someone who has access to everything in this world. We know that she was going through fertility treatments, probably to excellent fertility doctors, and still that wasn't offered to her. And so, partially it's because of how this has progressed in the past few years. And so it was available, but it was for experimental purposes about 10, 15 years ago. So we only used it in the oncofertility, basically patients who got diagnosed with breast cancer. Like I had a patient today, just got diagnosed. So we can go ahead and embryo eggs. So we can go ahead and stimulate their ovaries, get eggs out and freeze them. But it was not until about 2017 that there was enough data to show that for social reasons, social indications, we could also do this. And the technology also in that time changed a lot from slow freezing to vitrification, meaning vitrified eggs that go through vitrification have a much higher success rate of working as opposed to you freezing something, counting on something and not working. And so I've seen patients from 10 years ago that come back to use their eggs and they're don't work well. And nowadays we have no problem freezing women's eggs, and we know they thaw right, and we can get awesome embryos out of them. So much that now people can even purchase eggs from egg donors that are vitrified. And so part of this may have been the technology, and also a little bit of foresight, that you're working in the patient and the physician are working now. And so I feel that part of everything is counseling patients, even if they don't ask for it, to be able to put yourself in their situation and explain to them what their options are.
What changed over the last 5 years when it comes to women looking at this as an option?
So I think also depends on what part of the country you're going to be. So in a big city like us here, women go to college, they don't have a baby early on, they don't get married early on, they want a good job, they're professional, they get married for the right reasons later on, as what we consider here in their 30s probably. And then all of a sudden, you start seeing that their fertility declines after age 35. And that's that balance. How can I be successful in my career, but also have this for my personal life, my social life? And so it's become more known. I don't think we're there yet. A lot of physicians in the area still have no idea. They're still doing major ovarian surgery on patients, and they're still not offering them oocyte cryopreservation or egg freezing. But I think during the pandemic, especially, I think a lot of people had more time and slowed people down and had income they had saved, and they started thinking about themselves. When you don't have the distractions, you go like, what's important in life? And well, building a family is extremely important. So you invested for 15 years in your life, you're 35 years old, you don't have a prospect to getting pregnant anytime soon, and you know that fertility is declining. So these patients then have come back, and we've seen an explosion of women trying to freeze their eggs. And I think it's almost like something that goes viral. If someone does it, she tells her friends they did it, and they go, and they at least talk about it. I don't think someone necessarily needs to do it, but they need to at least be informed that's an option and an investment. And I now see couples that have been dating for 3 years, and then but they're not ready to move forward with that. And so she comes and she saves those eggs. And also it gives her the freedom that if the relationship were not to work out, that she hasn't sacrificed that huge important part of her life, and have those eggs frozen for future use with that partner or any other partner or donor sperm.
What are some of the deterrents to a woman freezing her eggs? Cost or
So
unknowns?
So I think cost and unknowns. The cost, um, we've tried to really bring it down where everything included, people can do it with us for about $10,000. And so that's doable for a lot of people, but that can also be a significant deterrent, especially when you're busy in your life and you don't have time to get it done. But the other thing is, it's kind of like cord blood. Like you save that just in case your kid has a problem in the future. Same thing here. It's a safety deposit that you may never need, and so there's that balance. So I think someone in their 20s without anything major going on in their life, probably life changes so much. You probably don't have to do it unless your egg reserve is low, for example, but you get that evaluated. But as you hit your 30s, get closer to 35, you have a pretty good sense of what's going on in your life. And I think that's the prime time where the eggs are still excellent and people can freeze them. Having said that, then I see patients that come to me and they're 42, 43. That is not ideal, but I cannot make that woman go back to being 36. And so she's frankly at her best at that point. And so women just have a huge burden. Their reproductive span is short, and they have to make these tough decisions. But it's actually something that can give them extra options. But I think that's where the counseling goes.
A woman's reproductive timeline kind of declines after the age of 35.
So to put it into more concrete terms, in your 20s, 20 to 30, you have a 25% chance of pregnancy per month trying. At age 35 is 12%, so about half. And at age 40 is about 5%. And at age 43 is 1%. And that's without any problems. So that puts it into perspective. Now, there's always an option. You can always, if you're older and you miss the boat, did not freeze your eggs, you can always do donor egg. But I think it's very important for people to try to have a biological child.
What if my eggs get swapped with someone else's? Like, does that happen? Or, well, I'm sure it can happen. We've seen instances of human error, but is that a deterrent that you hear from women about getting this procedure?
So very little. I mean, there's risk on everything. Obviously, when people are coming, they've had a lot of moments to themselves to realize where life has taken them and where they will be. And I think that risk is much bigger than the risk of this happening. This is one of the fields in medicine where 0 errors are allowed. We cannot have that error. But the chances of a catastrophic event to happen are so small. And frankly, what is the other option? If they stay inside of you, first of all, the eggs that we get out are eggs that you would have lost that month. So it's not that because you harvested your eggs and you froze them that you lost a cohort of your eggs. You would have lost them anyhow. And if you don't freeze your eggs and time goes by, the quality is going down and the number is going down. And so that is for sure. The other, it could happen. Like you could buy the lottery and you could win it. It could happen, but it's unlikely,